Well, health advice is more abundant than it's been these days, but with so much of it around, what is the right advice? And today we're talking about folic acid and vitamin D. Dr. Tamara Hunter joins us to bust some of those myths around these two essentials. Hi there, Dr. Tamara.
Hi, Emmy.
Now, first, let's talk about folic acid. Why is it so important, especially for pregnant women?
Well, it's a really confusing area right now. Certainly, folate is found in green leafy vegetables, and we know it's a really important phytonutrient for our health. And folic acid is the synthetic version of this, and we know is really important in synthesis of DNA, which is in our blueprint for our cells. So back in the 1980s and 1990s, they did loads of research, really good quality research, that showed that folic acid was essential to reduce neural tube defects. And as a result of that, foods have been fortified, breads and cereals, but in addition, women are encouraged to take a folic acid supplement, and that is a national recommendation.
Okay, so we're also seeing an increase in vitamin D deficiency. Why is that, and what impact does that have?
So vitamin D, another really important vitamin to be used in our bodies to help create bones, muscle function, and also our immune system function. And we actually make it in our skin. It's converted in our skin by sunlight. But because we're encouraged to slip, slop, slap to reduce the incidence of skin cancer, a lot of people are covering up, and therefore they're not getting their sunlight requirements, and therefore vitamin D deficiency. And you know, that's borne out in severe deficiencies like rickets that we see in children. And that's important for pregnant women because if they're low in vitamin D, then their children will be low as well.
Okay, so let's go back to folic acid, and we'll also talk about vitamin D. In terms of effective ways to replace them, is it simple as taking supplements for either of them?
Yeah, yes, is the simple answer to that. So folic acid recommendation is around periconception, so around the time of conception, because honestly, by the time a woman actually knows she's pregnant, the neural tube is already formed. So to take folic acid a month leading into pregnancy, about 400 micrograms, and for the first 12 weeks is really important. Vitamin D is a little bit different. You need to determine if someone is actually vitamin D deficient. So a blood test with your GP and a discussion around supplementation, certainly for pregnancy, but also for women who are postmenopausal, because once again, it's really important if you're vitamin D deficient to supplement it to reduce osteoporosis risk.
Okay. On the subject of deficiencies, I know some people have had iron transfusions. When should we be asking for those, and how soon should we feel those benefits?
Yeah, so iron is another interesting one, and certainly once again you need to determine if you're actually iron deficient. Most people can replace iron orally, so taking an oral supplement. Sometimes though there's some horrible side effects such as a little bit of bowel upset, so some people don't absorb it particularly well. It's only people who don't absorb it or aren't compliant with taking iron that would benefit from an iron infusion.
Okay, Dr. Tamara, there was a lot to absorb there, but thanks very much for all that advice.
Pleasure.
Have a great weekend.
You too.